Vitamins are essential to human health, but like many things, more is not always better. The modern emphasis on wellness has led to a dramatic rise in supplement use, with many individuals, particularly cancer survivors, older adults, and those with chronic illness, turning to high-dose vitamin regimens in the hope of boosting immunity, accelerating recovery, or preventing disease recurrence. But this growing dependence on supplementation is not without danger. When taken in excess, especially without medical supervision, vitamins, particularly the fat-soluble ones A, D, E, and K, can accumulate to toxic levels in the body, a condition known as hypervitaminosis. This state is not only harmful, but in some cases potentially life-threatening. Unlike water-soluble vitamins, which are generally excreted in urine when consumed in excess, fat-soluble vitamins are stored in the liver and fatty tissues. This means they build up over time, especially when taken in high doses. Vitamin A toxicity, for instance, can lead to liver damage, bone demineralization, blurred vision, and even intracranial pressure changes mimicking brain tumors. Vitamin D toxicity, increasingly reported due to the supplement's popularity, can result in dangerously high calcium levels, leading to kidney stones, vascular calcification, and cardiac arrhythmias. Overconsumption of vitamin E has been linked to an increased risk of hemorrhagic stroke, while excess vitamin K can interfere with blood-thinning medications and worsen clotting disorders. The risk is especially pronounced in cancer survivors and elderly individuals who are often motivated to pursue aggressive self-care regimens and may already be taking multiple medications. These populations are also more vulnerable to the side effects of nutrient overload due to changes in liver and kidney function, alterations in fat distribution, and reduced physiological reserve. For cancer survivors in particular, the assumption that high doses of antioxidant vitamins will protect against recurrence is not only unsupported by strong evidence, it may be counterproductive. Some studies suggest that excessive antioxidant intake during chemotherapy or radiation may actually blunt the intended oxidative damage to cancer cells, reducing treatment effectiveness. Despite these risks, many supplements are marketed with little oversight, vague dosing instructions, and aggressive claims of benefit. Consumers may combine multiple products, multivitamins, immune boosters, specialized anti-aging formulas, without realizing they are receiving far more than the recommended dietary allowances. In some cases, overlapping ingredients from various brands result in megadoses far beyond what any medical organization would recommend. This is particularly problematic in regions where supplement regulation is minimal or inconsistent, allowing products to contain unverified or mislabeled ingredients. Adding to the concern is the false perception of safety. Vitamins, being naturally occurring and associated with health, are rarely seen as substances that can cause harm. But in high enough doses, their pharmacological effects can be powerful and not always benign. Vitamin D, for example, acts more like a hormone than a simple nutrient, influencing gene expression and immune regulation. Modulating these systems without precise control can have unintended consequences, especially in people with autoimmune disease, metabolic disorders, or underlying organ dysfunction. To complicate matters further, signs of hypervitaminosis are often nonspecific and easily mistaken for other conditions. Nausea, fatigue, irritability, or muscle pain can resemble symptoms of aging, side effects of medication, or chronic illness progression. This makes the condition difficult to identify without specific testing and a detailed supplement history, which many clinicians may not initially pursue unless prompted. Left unrecognized, chronic vitamin toxicity can erode health silently over months or years. The key takeaway is that vitamins are not inherently safe just because they're essential. In supplemental form, especially at high doses, they act as pharmacological agents and must be treated as such. For individuals at greater risk, such as cancer survivors, the elderly, or anyone with complex medical conditions, supplement use should be tailored, cautious, and closely monitored by healthcare providers. Blood levels should be periodically checked when taking fat-soluble vitamins long-term and dosages adjusted to prevent accumulation. What starts as an effort to strengthen the body can easily become a source of hidden toxicity when good intentions collide with misinformation or excess. In the quest for health, balance matters more than abundance. While correcting deficiencies is critical, overshooting the mark can be just as dangerous as falling short. Vitamins are powerful tools, but like all tools, they require precision, not excess, to do their job safely.